I want to switch over to causes for a bit. And, given that this is how it ties into my industry, which I've been in the beverage industry for over 20 years, and we're getting hit really hard. So the WHO in January of 23 came out and said, no alcohol is good. So, our government's like 2 drinks for men, 1 drink for women is fine, blah, blah, blah. But I will say that through my entire journey working with all 3 of the doctors with Texas Oncology, not one person asked me or mentioned it or told me to change or said really anything about it. It's all about obviously fixing the situation that we're in and hopefully preventing it in the future. But now the Surgeon General came out and said the suppliers now have to put can cause cancer on the labels.
Mm-hmm.
And so I also feel, just in my personal opinion, we're GMA people, Good Morning America on ABC, and Robin had a very public, bout with breast cancer. And so I don't know if they are doing it more than the other channels. I don't know, but they did it a lot. And I feel that our industry got hit hard really bad.
Mm-hmm.
I felt like they didn't go through all the things, but they stopped at alcohol, or at least they made sure that they blamed it on alcohol. And okay, I mean, fine, but that's not the real story. That's not the whole story, right? And so for me, I'd like to just walk through some of the risks that I got here in my pamphlet.
Okay.
And it and just and then can we kind of talk about what you feel about alcohol and its effect and
Yeah, we'll be generalities. At least when it comes to, okay, that's fine.
Yeah. So I got to put my glasses on, excuse me. So this is from Sarah Cannon, which is part of I guess it's part of the Texas Oncology, or partner with them.
Yeah, we're partners.
Partner, okay. So this is a risk, and they're saying being older in age, which we talked about already, earlier age when your period starts, which Dr. Di Pasquale said it's now 11. I think
as far as
than 13, it's younger.
Are you talking about like the average?
Yeah, the average age of women are it's used to be 13. I guess it's now 11 or younger. Having dense breast tissue, which was my case. Having other people in your family, BRCA, of course. Having had radiation to the chest, which I don't know about that. Having breast cancer in the past. DES, or synthetic estrogen. Now, would that be like an IUD?
No, that would be more with women that are taking like hormone replacement therapy.
Okay. Drinking more than 5 drinks beer, wine, liquor per week, which, by the way, we're now at what, number 10 or 11 or 12? Being overweight and not exercising. So for me, it's like, yes, this is a thing, but why are we getting hit so hard with it, I guess, is,
Well, in general, kind of circling back, I think, all of those risk factors are not made equal. And in general, most of those are going to be, I wouldn't say, for a lot of times, anything that's going to increase your body's baseline estrogen is going to be an increased risk. So just make sure, it's kind of one of those like, well, no doubt when you think about it, but it's like if you have a cancer that is driven and fueled by estrogen and progesterone, anything that increases estrogen and progesterone in your body is going to increase that. And not only that, because again, with your cycles, you're going to have these peaks where it kind of gets high and drops off high and gets dropped off. So it's like it's stimulated and it's relaxing. It's stimulated and relaxing.
So like for me, for example, given the fact that I literally have had a period every 28 days since I was 13, that's the highs and lows that you're talking about.
Right. And so it's just because when you go through puberty and start your cycles, that's when your body is ramping up this estrogen. And so it's just saying when you go from that and then you have either late menopause, it's just length of exposure to that fuel that is a part of it. And then obesity, again, that is just ways that there's going to be a higher level of estrogen in the body in an obese individual. And so again, it's just that same type of thing where there's going to be more chances of stimulations in those cells. And so with all of that, it's talking about like how much exposure you have to estrogen. Yeah. And so I think within that, again, with alcohol intake, we can see kind of higher levels. It's one of those things where it's like moderation is key, right?
Right.
So
100%.
We can definitely see higher rates of issues in patients that are, of course, abusers of alcohol, and more so if we're also dealing with either liver injuries or things of that nature. Breast cancer is not one that I think of as being strongly related with alcohol intake as opposed to, head and neck cancers, gastric cancers, liver cancers that are going to be far more associated with in patients that are drinking a lot more. But it's kind of a circuitous risk that if an individual is drinking a lot more alcohol, their system may have more that they have to process and deal with.
Yeah, I could see where, for example, if I have a drink or two and it affects my immune system, right? Because that can happen. And if your immune system isn't strong enough to fight the cells, because you have cancer in your body, right? At all times, your body just expels it. Am I understanding
Yeah, I mean,
that
that's
right?
definitely your immune system is constantly in surveillance, and cells typically that are having mutations where they could turn into cancers or have malignant potential, they will typically send out signals that something is wrong, and the immune system will take care of that.
Yeah, which the body's pretty neat.
It is. It's also slightly terrifying to be like, oh, my body is constantly trying to kill me. It's a little bit of a morose thought, but in general, yes, your immune system, especially in other types of cancers, namely skin cancers, are kind of one of the top things that we think about with patients that are on either chronic immunosuppression or have other conditions where their immune system is really knocked down, that we see that plays a big role in the generation of those types of cancers.
Gotcha. Okay.
Now, I can't unfortunately speak to any expertise on the effects of alcohol on the immune system and how robust that may or may not be. But in general, again, like what I say with my patients, I don't really like them to take it while they're on active chemotherapy, but when they're in their kind of maintenance phase in surveillance, I usually do not have a problem with having a glass of wine here or there. It's mostly moderation that we talk about.
Yeah, well, there's a big movement in our industry towards moderation, but also just not drinking. THC, CBD drinks have really come to the forefront. Tinctures with adaptogens, feel-good things, legal things. But with the rise of these non-alcoholic cocktails and beers, you're seeing a lot of people substitute a drink here or there. Restaurants are getting better and better all the time about having mocktails on the menus, and they're getting really good at it. And so I think that, especially with the generations that are coming behind us, there'll be a lot less drinking, I would say. It just in general, like the baby boomers in our generation. I don't know if you're my generation X or not. Okay, because I feel like our generation just followed the baby boomers. We just did what, okay, we'll just do whatever they did. It's the millennials that came in
I think in general, overall, I think people are doing better about educating themselves on health, and they're interested in, for better or worse, sometimes depending on, what resources people are using to educate themselves. Sure. But I think there is, with the internet and the ability to kind of educate yourself on a lot of things, I think there is a push towards trying to kind of be a little bit healthier, understand the full repercussions of either alcohol abuse or smoking, anything like that can increase your kind of health issues. And we're seeing less cases of, smoking has been a lot less prevalent as we learned a lot more about the risks of smoking. And so I think that's the other thing, is there's not really a good way to be able to say what is the safe amount of alcohol that doesn't increase your risk. And so in a lot of those cases, they just say, okay, the healthiest thing is then just don't drink. If we're not sure if it's going to be a problem for you or not, then of course the safest thing is not to drink.
Right. Yeah. Yeah. And that makes sense, but I think it's, you look at all the processed foods people eat and all the other garbage out there, and it's like,
right. Yeah.
Why is that not cancer risk?
but I mean, that's a part of it too, is what we were talking about.
Yeah.
On your list, obesity is definitely a risk, and part of that is just, that may be getting into, the just how hard life can be sometimes, when it comes to finding healthy, balanced foods can be really challenging. But in general, like I said, in most times, I don't mind if patients have a cookie or a slice of cake or some ice cream, things like that. So again, I don't want them eating that for every single meal of the day, and that be the only part that they get any nutrition. That's how anytime, because that's a big question that a lot of my patients will ask me, is like, I've heard that we need to do intermittent fasting, or that I need to cut out all sugar and things like that. And so I say, you're going to hear a million different recommendations about a million different diets, that this feeds cancer or this kills cancer. You need to eat this, but not this. And that's going to solve all of your problems. And the problem is we're not going to really ever have robust data on kind of any supplement or an exact diet or anything like that. So in general, a standard healthy diet, get some fruits, get some vegetables, get some good lean meats, all of that. But you can still have your coffee in the morning. You can still have, a dessert here and there. You can still have a cocktail here and there. And overall, if otherwise your health is good and there's nothing else that I have any concerns about, I don't think that is going to be the difference between you responding to your treatment or the risk of your kind of disease coming back, when there are so many other modifiers, such as, having that routine exercise, continuing on your medications, continuing on your surveillance, that's going to be so much more important day to day than, again, a cookie every once in a while or a glass of wine every once in a while.
Well, that's good. I don't really crave sugar very often, but I do love chocolate, and I love peanut butter, and I love oats, and so I'll do a peanut butter oat chocolate cookie every once in a while.
That sounds amazing.
Make them without sugar, and I just put them in the freezer, and I'll just have one every once in a while. It feeds the need.
Yeah, go for it.
Yeah. And I figure it's got oats in it, so it can't be too horrible, and it's got protein in it, so it's not,
You can paint it however you want to do it. I'm saying it's fine, regardless.
Oh, awesome. Well, this has been really fun. Thank you so much for your time.
Yeah, absolutely. I enjoyed talking with you.
Yeah, no, this is really great. I really appreciate just helping spread the word and educating us on from a doctor, right? Not from necessarily a morning news show. It's from someone that's active in the community helping patients every day. So I really appreciate it, and I've learned a lot. So I thank you.
Yeah, absolutely. Like I said, it's my absolute pleasure. And I guess if you have any other questions in the future, anybody could reach out to me. Again, I'm at Texas Oncology at Medical City in Dallas.
All right. Awesome. Well, thank you so much, Dr. Hayes.